Hello and Assalamu alaikum Ultrascan Diagnostics. Here, this is the CVCT of the patient that you had requested. The area of interest is the upper right 6 and 7 and upper lower left 6 for crack evaluation. This is the upper left 6 and 7. Let's start with the crown portion on the axial view. Nothing significant that we can see on this view. As we move inferiorly, we can see some form of a radiolucency associated with the distal part of the 7. No cracks can be seen. As we move further towards the apex, we can see that the obturation is decent. We've got a slight bit of an MB2 missed out on the 6, and then as we move towards the apex, you can see we've got a radiolucency in the 6 and we have a radiolucency in the 7 and 6 parietal rods. Now moving to the transaxial view to get a better understanding. This is the transaxial view. Here you can see we've missed out on the MB2 and we've got a significant periapical radiolucency with the mesial root, a radiolucency with the parietal root, and a slight bit of a radiolucency with the distal root of the 6. As we move towards the 7, the 7 parietal root is severely infected. We have a radiolucency and we have a radiolucency on the distal of the 7 as well. Other than that, we cannot discern any major problems than these failing endos, and also the fact that there is sinusitis, which could most likely be odontogenic in nature. Moving to the lower left 6, as you can see, endodontic treatment in the mesials, which is done. Very slight bit of radiolucency in the mesial, and as we move towards the distal aspect, there we go. Here you can see endodontic treatment done, but here also we can see a radiolucency associated with the distal part, and we see a slight bit of a line here in the lower left 6. As we move inferiorly, you will be able to see this is the lower left 6, and we're trying to locate a crack in the lower left 6. We see a slight bit of a line here. The lower left 6, the distal root is definitely showing signs of a crack or infection, as you can see, which is extending, and we can also see a missed canal here in the lower left 6 endodontic treatment, which is very visible right here, and there is a significant radiolucency associated with the lower left 6 distal root specifically. As we move towards the lower left 8 and its nerve relationship, you can see on this view right here, the lower left 8 is mesioangular impacted, horizontally impacted, and the apex is approximately very close, overlapping the inferior alveolar nerve. At its maximum, the distance between the two is approximately 2 millimeters. So it's not compressing it. On a two-dimensional X-ray, it will look like an overlap, but it is 2 millimeters away. As we move towards the lower right 8, you can see the lower right 8 also is significantly close. The apex approximately is just a millimeter away from the nerve on the right hand side. This is the axial view. Here also you will be able to appreciate that this is the right hand side, very extremely close, and this is the left hand side, which is relatively close but not in danger. Something to be kept in mind is the fact that we've got a very thick cortical plate on the lingual, which seems to be fused with the wisdom teeth, and could be a significant factor in the extraction.